The nation's insurance companies have until September 20th to either pull out of the Obamacare exchanges or commit to participating in 2018. So what do you do if you want health insurance, but there's nobody to buy a policy from? It's a very real problem for people in Nevada. 13 of the state's 16 counties, plus one independent city, will have no insurance plans offered. On January 1st, 8,000 people in Nevada will be left uncovered. Benefits for others will be cut back. Why? Insurance provider Prominence Health pulled out of the exchanges. Anthem Blue Cross and Blue Shield reduced coverage to the remaining 3 counties, with Anthem calling the insurance market volatile. Heather Korbulik is executive director of the Silver State Health Insurance Exchange. Heather, nice to have you with us.
Thank you for having me.
When the insurance provider pulled out, what exactly did they tell you as their rationale?
The insurance industry relies on understanding risk, and when they don't have an idea of what their risk is going to look like, and they don't understand if their cost-sharing reductions will be paid or if people will be incentivized to be buying insurance, it creates a certain uncertainty that insurance carriers just can't identify what the risk will be, and they get very unsteady and very uncomfortable.
So then you think there's a direct line between the president's risk to take away the subsidies and what you're seeing in your state?
Absolutely. The federal instability has created instability in Nevada for those individuals who are out in rural communities and for those individuals who are in our more urban populations, with rate increases up to 38% average rate increase in Nevada right now. We're seeing that uncertainty play out not just for those people in those bare counties, but also for our urban populations.
How do you encourage a provider? What does encourage? What does the word encouragement mean? Is that a payment? I mean, how do you incentivize them when the other factors are clearly not going to change?
Well, you're hitting on a really clear point here, which is that Nevada has very little leverage. I mean, most of the controls are in Washington, D.C. right now, and whether or not cost-sharing reductions get paid is entirely out of the control of our state. So, we are looking at and having conversations with carriers about what they need from us and what's within our control in order to incentivize them to come into our marketplace.
What defines stability, and how do you get stability? Everyone always talks about we got to get some stability in the marketplace. What's stability, and how do you get it?
One of the most important parts of stability in the Nevada marketplace is really encouraging a healthy risk mix. So you don't just want to incentivize sick people to access insurance. You want to have healthy younger people in the risk mix. So, yes, the individual mandate is an unpopular part of the Affordable Care Act. However, it does incentivize young, healthy people to be in the market, and that brings down the costs for everybody else who participates. So without enforcement of that individual mandate, I think we'll see even more inconsistency and a dicier risk mix, meaning more just sick people accessing health insurance and young, healthy people staying out of that pool, which will drive up costs for other people.
Are you hopeful?
I'm hopeful, but it's been a rough 6 months.
I was going to say, that was the biggest sigh I've ever heard anybody about to answer a question line. That was like, sigh, I'm hopeful. So it's been a struggle.
I think I share in the fatigue of my colleagues across the country, and for health policy analysts and for healthcare reporters. We are. It's been extremely dramatic 6 months in an area that is usually somewhat boring. We're living in a different world, and I'm hopeful that things will start to steady and that we'll be able to give some assurances to our carriers, and that we'll be continuing to be able to provide affordable care for Nevadans.
Heather Korbulik, nice to have you with us. Thank you for your time.
Thank you.